Assalamualaikum and a very good day. My name is Fazira Herina binti Rosli. Today I'm going to present the topic of lower limb fracture from my clinical practice of pre-hospital care and ambulance service. Okay, now I'm proceed to the definition of fracture. Fracture are a result of strong force inflicted the skeletal part of the body. Fractures vary greatly in size and severity, and they can range from a small crack, fracture of the hand bone, to life-threatening fracture of the neck and pelvic bones. This is from the KKM 200 2019. Alright, and the lower limb fracture is a complete or partial break or crack in a bone localized at the area of hip, thigh, leg, ankle, and foot. The epidemiology of lower limb fracture are relatively common injuries, with the incident varying by age, gender, lifestyle, and geographical location. Incident rate are generally higher in males, especially in younger age group, but increase in females, particularly in older age group, due to the osteoporosis and fall. Okay, the age distribution, we can say that fracture of the lower limb occurs across all age group, but the patterns differ. Younger individuals often experience fracture due to high energy trauma, sport injuries, and accident, while in older adults, the incidence of lower limb fracture, particularly hip fracture, increasing significantly due to falls and bone fragility, such as cancer and osteoporosis. Okay, the clinical presentation of lower limb fracture, it can be pain and tenderness, especially on movement and palpitation. Secondly, they will have numbness, tingling sensation, and abnormal sensation in the extremity. And then it can swelling and bruising around the affected area. The crepitus sensation or sound of grinding or crackling at the fracture site when the bone move against each other. And then the other clinical presentation is open wound that we can see, or skin breakage where the bone has penetrated the skin, and the limited range of motion and difficulties and inability to move the affected limb. And then we can see the deformity or abnormal alignment of the limb angulation of the limb, is either angulation, rotation, or shortening. And they also may have inability to bear weight and instability. And then the last but not least is compartment syndrome. There may be signs of compartment syndrome such as severe pain, swelling, numbness, and changes in skin color and temperature. Okay, the lower limb fracture include, as I mentioned before, is hip fracture or dislocation, femur fracture, patella fracture, knee dislocation, tibia fibula fracture, and ankle fracture. Hip dislocation is a break in the bone of the hip joint, usually occurring in the femur, which is thigh bone or pelvis, common in the elderly, and the result from fall or trauma. Hip dislocation is the ball of the femur is forced out of the hip socket, and this is a serious injury that requires immediate medical intervention. Okay, this is the femur fracture that we can see here. This is the extracapsular femur fracture here. And then this one is the clearly showing that the mid shaft femur fracture. And this is the distal femur fracture. You can see here. Clear. This is from CT scan. Okay, now we proceed to the patella fracture and knee dislocation. Patella fracture or kneecap is usually caused by a direct blow to the knee. They can be partial or complete breaks. Knee dislocation occurs when the bone of the knee are out of the place, when often due to traumatic It is severe injury that requires immediate medical attention to relocate the knee. Alright, this is the patella, the film of patella fracture and knee dislocation. This is X-ray film. This is patella. We can see that the fracture of the patella here, and this the knee dislocation. We can see that is glide to the side. Alright, the tibia fibula fracture. Tibia fibula fracture are the tibia fibula is the bone of the lower leg, and this also can occur from trauma, fall, and other sport injuries. We have three, like femur fracture also. They have proximal tibia fracture, or we call it tibia plateau, tibia shaft fracture, and distal tibia fractures. Or we have tibia pylon or plafond. Alright, this is the tibia pylon or plafond fracture with intact fibula. Pylon is actually a French term. This is an additional information. Pylon is a French term for the injury of mechanism, meaning hammer of Tesla. A pylon fracture is a high energy trauma with articular impacted and combination. See, the fracture is here. Alright, tibia fibula fracture. This is, we can see that the lateral tibia plateau fracture. Here is the fracture. And this is tibia shaft fracture. Here we can see that it is a middle, and then this is the tibia distal fracture, distal end of the leg. Alright, ankle fracture involving any of the ankle bone, including the tibia fibula and the talus. This can be vary in severity and may be simple or compound fracture. The most common of ankle fracture is due to weight bearing, skeletal injury. Alright, the incidence of ankle fracture has doubled since the 1960s. This is the old one, or sorry. And the highest incidence is the elderly woman. Okay, this is the ankle fracture according to the Weber and Low Hansen. They have three categories, which is A, B, and C. The A one is they have two fracture here, tibia fibula, we call it supination abduction, which is that this is rotated to over here. And then the B also have two fracture here and here. We call it supination exorotation, the rotation over here. And the C one is the rotation over here. They have the fracture here. We call it pronation or rotation. Okay, the management at the scene in pre-hospital care for the lower limb fracture is we treat these injuries depend of the severity and the type of fracture or dislocation. It may involve immobilization, casting, splinting, traction, surgery, and rehabilitation to regain function and strength. Early and appropriate medical intervention is crucial for successfully recovery and to minimize complications associated with these injuries. Physical therapy and rehabilitation plays a significant role in restoring mobility and function after treatment. Alright, for the treatment actually, usually at the pre-hospital care, I will assess the patient, ask the patient to ambulate and stand up if they can. If they cannot stand up, they may have fracture of lower limb, and I will put on splinting and bandage at the bleeding area and put the splinting for the immobilization to transfer the patient to the hospital. That is what I usually do in pre-hospital care. And then we proceed to the complication of fracture. Complication of fracture may be delay healing or non-union. And then they also can lead to malunion occurs when the fracture bone heals in abnormal position, alignment, or angulation, which is that is the healing is not nice lah. And then the infection partially or to the open fracture, and we can have compartment syndrome due to lower limb fracture, deep vein thrombosis and pulmonary embolism due to the long stay in back because of the fracture. And then fat embolism syndrome can cause respiratory distress, neurological symptom, and other complication. Nerve and blood vessel damage, osteoarthritis that resulting from the chronic pain and joint dysfunction. Sympathetic dystrophy. It is a complex regional pain syndrome that causes severe and chronic pain. And then they also can have muscle atrophy and weakness. Functional impairment lead to reduced range of motion, strength, and overall function capacity. And then the physiological impact as a fracture can have emotional and psychological effect, including anxiety, depression, and fear of re-injury or pain. Alright, now I proceed to the case study for my clinical practice in pre-hospital care. Lower limb fracture is regarding Mr. Goh Ah Heng. He is a 91 years old Chinese male who has a medical history that includes underlying conditions such as diabetic, hypertension, and acute coronary syndrome. And on a scene of assessment, Mr. Goh Ah Heng lay at the roadside and unable to move or lift up his leg after falling from his bike. During the physical examination, we observed a sign and symptom consistent with a lower limb fracture, including tenderness and deformity, which significantly restricted Mr. Goh Ah Heng movement. Thankfully, Mr. Goh Ah Heng was stable with clear air entry, no shortness of breath, no significant bleeding, and no tenderness over the chest and abdomen. And his vital sign was stable, and confirming that he was in a good condition except for the leg. And then we conducted a thorough assessment to determine is there were a critical condition that required immediate attention. Our focus was on the patient airway, breathing, and circulation, as well as their level of consciousness and any other potential injuries of symptom. If there are visible bleeding, we acted quickly by applying sterile dressing such as gauze of gum to cover the bleeding and put pressure to the wound. And after that, we prep the area with bandage to stop the bleeding effectively. And then we ensuring the patient's comfort was and provide pain relief to measures such as opiates or NSAID to ease the treatment. Usually we can give tramal to control the pain. We continuously monitor the injury of the limb vascular and neurological health by carefully assessing the impulse, capillary reflex sensation, and motor function. Any changes or abnormalities we observe were documented for continuous tracking. Okay, in case of fracture associated injuries, we assess the severity and provide additional support measures as needed. They may include oxygen supplementation, fluid resuscitation, and addressing any other medical condition or injuries. Alright, thank you. That's all for me.